This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss ketamine infusion therapy for bipolar depression. Now, bipolar depression is a complex disorder, and there are many patients who have treatment-resistant depression who may actually have bipolar depression. And many people are diagnosed with bipolar depression that get depolarized and re-diagnosed with just treatment-resistant depression. So there's a spectrum of phenotypes that are associated with this particular problem. But just in brief, bipolar disorder is a mental health condition associated with extreme mood swings over time and can include emotional highs and lows, the lows being depression. And these mood swings can occur rarely or multiple times per year. And this is a lifelong condition. Mood swings can affect sleep, cognition, behavior, judgment, and energy levels. And of course, there could be anxiety, restlessness, irritability, agitation, brain fog, especially during hypomanic phases. Now, many individuals will have significant periods of depressive symptoms that start at an early age with classic depression symptoms. And treatments with traditional antidepressants, such as SSRIs and SNRIs, have poor outcomes and can result in effective switching, basically where you change from depression to manic or hypomanic states. And hypomanic states would be things with anxiety and restlessness, irritability, agitation, and a number of other features very similar to mania. Now, depression in bipolar disorder looks like depression in any other state where basically you have feelings of sadness, emptiness, hopelessness, and tearfulness. And there's a loss of interest or feeling no pleasure at all, with maybe weight loss or weight gain or changes in appetite, insomnia or excessive sleeping, restlessness or slowed behavior, fatigue, loss of energy, feelings of worthlessness or guilt, and also decreased ability to think or concentrate. People begin to be indecisive, and then in the extreme cases, people start thinking about planning or attempting suicide. Now, some of the key points of bipolar disorder is that it affects at least 1% of the population, and it has the highest lifetime risk of suicide, with 15 to 20% of deaths in bipolar disorder of being from suicide. It's the highest of all psychiatric disorders. And treatment failures are higher than in major depressive disorder. And for patients who are treatment-resistant bipolar disorder, there's actually limited evidence for medication-based treatments. So the other issue which we just mentioned is that many people with treatment-resistant depression may actually have bipolar disorder. And it's important to note that there's a neuroprogression and structural brain changes in bipolar depression. It gets worse with age. And this can be associated with metabolic complications. So the problems in the brain metastasize peripherally with increased risk of heart attack and stroke. So does ketamine therapies work for bipolar depression? And yes, they can work. Now, we know that ketamine works for unipolar depression, and subanesthetic or low doses of ketamine are rapid, potent treatments for depression. And we have studies such as the one with Berman and colleagues in 2000. Then we have a number of other ketamine studies that have demonstrated efficacy in both treatment-resistant depression, unipolar depression, suicidal ideation. Some of them are listed here with Hugh and his group in 2016 and Wilkinson in 2018 on suicidal ideation. Utilizing a single dose of ketamine, they did a systematic review demonstrating efficacy, and the list goes on. And we also know that repeated doses of racemic ketamine can help sustain effects in treatment-resistant depression. And we know that there's been fewer studies in bipolar depression alone. So we have studies by Moreau and Ghassemi and Lopez-Diaz and Ionescu. It's both studies, case reports, and systematic analysis, and the list goes on. So ketamine infusions can rapidly reduce suicidal ideation as well. And there's been numerous studies as well demonstrating this. And we have Ryan Statler in 2015 performing a systematic review of the literature showing that ketamine is a effective treatment for suicidal ideation. And there's case reports with Lopez-Diaz group showing IV ketamine does help in treatment-resistant bipolar depression with suicidal behavior as a means of rapid treatment, as well as multiple others that you can see here on the screen. Now, studies also demonstrate ketamine has efficacy in bipolar depression. We have studies with Zarate and Diaz-Granados, as well as Grunebaum and Chen, in both randomized controlled trials, as well as a number of other formats for these studies. So the first randomized controlled trial for ketamine in bipolar disorder was Diaz-Granados study in 2010, and they used a randomized placebo-controlled double-blind crossover trial that was really an add-on study from one conducted earlier. And the individuals were maintained on their lithium and valproate and received a single dose of IV ketamine or placebo. And they used the Montgomery-Åsberg Depression Rating Scale, the MADRS, as the primary measure, and noted that basically 71% of subjects responded to ketamine and 6% responded to placebo. Ketamine was generally well tolerated. Now, there was a replication of this ketamine study in bipolar disorder with Zarate's group in 2012, as also as a double-blind randomized crossover placebo-controlled study in 15 subjects. And these individuals were also maintained on their lithium and valproate, receiving a single intravenous ketamine infusion at 0.5 milligrams per kilogram, and then also measured the MADRS as well, noting that there were improvement in these results that were significant through day 3, with 79% of subjects responding to ketamine, 0% responded to placebo. And so this was a replication study from Diaz-Granados group. Now, ketamine helps depression also in anxious bipolar disorder patients with depression. And in this particular study with Ionescu in 2015, 36 patients with anxious and non-anxious treatment-resistant bipolar depression types 1 and 2 currently treated with lithium and valproate were given a single ketamine infusion over 40 minutes at 0.5 milligrams per kilogram. And they did post hoc analysis using the MADRS and also the Hamilton Depression Rating Scale in anxious versus non-anxious depressed patients through day 14. And they noted that both anxious and non-anxious patients with bipolar depression had significant antidepressant responses to ketamine, although the anxious depressed group did not show a clear antidepressant response disadvantage over the non-anxious group. So basically, we know anxiety is actually a predictor of poor treatment response in bipolar depression. And this study, basically the anxious and non-anxious groups had similar effect with the ketamine itself. Now, further studies have also demonstrated efficacy of ketamine infusions for bipolar depression. And in this particular case study, Permoda Osip and her group in 2014 took 42 patients. And these individuals were on at least one mood-stabilizing medication. And they discontinued antidepressants and gave an IV infusion of ketamine at 0.5 milligrams per kilogram. And they followed the individuals with the Hamilton Depression Rating Scale and looked for an improvement of greater than 50%. And they found that basically that there was significant improvement in the individuals within 24 hours after the administration of ketamine, with a significant decrease in these rating scales. And that the ones that did improve the most had a higher frequency of alcohol addiction and family history of alcoholism. So this confirms a rapid antidepressant effect of ketamine, maintaining that effect for up to 2 weeks based on this study alone. And basically, these individuals, again, had bipolar depression. Now, ketamine also can augment depression scores in patients with treatment-resistant bipolar depression. And one ketamine replication antidepressant study with Rybowski's group, 2017, took 53 patients. And these individuals, again, were receiving one or more mood-stabilizing medication. They measured these individuals using traditionally validated medical scores, such as the Hamilton Depression Rating Scale, and assumed that the reduction of greater than 50% would be the criteria for response after 7 days, and noted that 51% of the individuals, or 27 subjects, met criteria for response, and more frequently it was males than females, to some 77% for the males and 43% for the females. Now, is ketamine safe? And in Rodriguez's and McIntyre's study, they looked at the safety and tolerability of IV ketamine in adults with major depressive or bipolar disorder. And they used retrospective data, analyzed 203 patients with treatment-resistant depression who received repeat dose IV ketamine, and looked at things such as hemodynamic changes and also other adverse events, such as the clinician-administered dissociative scale. And they noted that ketamine was well tolerated, with less than 5% of patients withdrawing due to tolerability concerns. Now, they did have some measurement changes in blood pressure that increased during the infusion. Some 44% had some treatment-emergent hypertension, but a small percentage of those needed to have medications given, and most of those were resolved after the infusion. There was some drowsiness, dizziness, dissociation in about a third, but they just, based on the study, felt IV ketamine was safe and well tolerated. Hypertension was commonly observed during the infusion, but was very transient. And also, dissociation was the most frequently reported event after the first infusion, but kind of resolved over the series of infusions. There was no also psychosis, there was no mania or new onset suicidality with IV ketamine in this review. Now, a meta-analysis of ketamine in bipolar depression, treatment-resistant depression, with Kishimoto's group in 2016 looked at 14 randomized controlled trials with some 234 patients. And basically, they noted that ketamine reduced depression significantly more than placebo. And this began as early as 40 minutes and peaked at day 1. And basically that compared with placebo or pseudo-placebo, ketamine had a greater response overall and remission. So a single ketamine infusion, based on this meta-analysis, demonstrated ultra-rapid efficacy for major depressive disorder and bipolar disorder. Now, there are some predictors of response to ketamine infusions. And in Machado Vieira's group and Nisiu's group, they looked at different clinical predictors of ketamine response in treatment-resistant depression. And among the things that were noted is that patients with a high BMI, a body mass index, as well as those with lower baseline levels of adiponectin, were predictors of positive response to single ketamine infusions. And this suggested that basically a metabolic imbalance may be related to ketamine's antidepressant effects. And adipokines have a role in metabolism, including BMI. They regulate inflammation, neuroplasticity, and influence insulin sensitivity. There's also some regulation of sympathetic outflow as well with adipokines. And so these have all been implicated with mood disorders. And so looking at some 80 treatment-resistant subjects with major depressive disorder or bipolar depression, they gave a single ketamine infusion, and plasma adipokine levels were measured at 3 different time points. Looking at the MADRS scores as well as the Hamilton Depression Rating Scale, they noted that lower baseline levels of adiponectin predicted ketamine's antidepressant efficacy. And because adiponectin significantly improves insulin sensitivity and has potent anti-inflammatory effects, this suggests that these specific systemic abnormalities might predict positive response to ketamine. Also noted was ketamine did reduce resistin, which is a pro-inflammatory compound, so it decreases inflammation by lowering this particular substance. Now, sublingual ketamine has also been used for treatment in bipolar depression. And in this particular study with Lara in 2013, sublingual ketamine was utilized in individuals with bipolar depression and unipolar depression. And basically, they noted that sublingual ketamine is absorbed somewhere around 30%, and it's got less conversion to norketamine than oral administration. And using 10 milligram dosing that's held for 5 minutes under the tongue and then swallowed and repeatedly administered every 2 to 3 days or weekly, that 26 outpatients with refractory unipolar or bipolar depression had clear sustained effects. Somewhere around 77% of these patients improved with mood, cognition, and sleep, with minimal or transient side effects such as lightheadedness. Now, as far as extending the results and improving results with patients with bipolar depression, multiple infusions certainly seem to be the way to go. And Zheng's group in 2018 looked at 97 patients with unipolar and bipolar depression, somewhere around 20 patients with bipolar depression, who received repeated ketamine infusions. Now, these infusions were 0.5 milligrams per kilogram over 40 minutes, and the MADRS scale as well as suicidal ideation scales were measured. And after 6 ketamine infusions, the response and remission rates were 68% and 50.5% respectively. And that they noted that within 4 hours following the first ketamine infusion, that there were improvements and significant decreases in these particular scales. So effectively, there was a rapid and robust antidepressant and anti-suicidal effect based on this study here within 4 hours that was seen, and it was maintained and sustained following the subsequent infusions. Now, ketamine is an antidepressant and anti-suicidal agent in bipolar disorder, bipolar depression, treatment-resistant depression, and based on a study with Dr. McIntyre's group in 2020, they'd looked at some 213 adults with major depressive disorder or bipolar disorder, and they kind of lumped them all together. And these individuals had received IV ketamine at a community-based multidisciplinary clinic. And they noted significant improvements in depressive symptoms after 4 initial infusions of IV ketamine. And they noted that the response rate was 27% and remission rate was 13%. And patients receiving IV ketamine had anxiolytic effects, improved overall psychosocial functioning, and reduced suicidal ideation. So IV ketamine was found to be safe, well tolerated, and effective at improving depression, anxiety, and functional impairment symptoms in a well-characterized cohort of adults with treatment-resistant depression. And again, they didn't separate the patients with bipolar depression and treatment-resistant depression in this analysis, but they lumped them together. The other study evaluating individuals with bipolar depression included individuals who have basically mixed features, depression with mixed features such as agitation, irritability, anxiety, and suicidal ideations. And McIntyre's group in 2020 took 201 patients, and they had treatment-resistant depression or bipolar disorder and used repeated dose IV ketamine treatment at a community-based clinic. And they found that looking at measuring symptoms of anxiety, irritability, and agitation as measured by the General Anxiety Disorder 7, the GAD-7 scale, and also the QIDS, that individuals with anxiety, irritability, and agitation experienced a significantly greater reduction in overall depressive symptoms, anxiety, and irritability and agitation. And that basically these are a very difficult group to treat in general. Ketamine seemed to have a very robust effect on these particular subjects. Now, ketamine also is helpful in decreasing suicidal ideation, which is common in patients with bipolar depression. And most studies do lump treatment-resistant depression and bipolar depression together. Now, in a study by Ballard and his group in 2014, 133 patients with treatment-resistant depression received a single subanesthetic infusion of ketamine, and they evaluated the relationship between suicidal ideation and depression and anxiety symptoms using the Hamilton Depression Rating Scale, the Scale for Suicidal Ideation, the Beck Depression Inventory, and the Hamilton Anxiety Rating Scale. And they focused on 230 minutes post-infusion. They found that ketamine infusions were associated with significant reductions in suicidal ideation compared to placebo. and that basically improvements in suicidal ideation after ketamine infusions were related to, but not completely driven by, improvements in depression and anxiety. So suicidal ideation and depression are separable entities when it comes to ketamine treatments. And further studies with Bartoli's group in 2017 looked at a meta-analysis of 5 studies, 99 subjects treated with IV ketamine, bolus or infusions, and showed also a large and consistent decrease in suicidal ideation. And that basically ketamine was efficacious across a number of different time points. And of course, repeated ketamine infusions for suicidal ideation seem to prolong the effectiveness of this treatment. And Jean in 2019 took 86 unipolar and bipolar depressive patients with current suicidal ideation and administered 6 ketamine infusions over 12 days. Looking at the HAM-D score and the Beck scale for suicidal ideation at a number of different time points, they noted that 57% of patients had relief of suicidal ideation after the first infusion and 65% after 6 infusions. And that basically the results of this showed 6 repeated ketamine infusions for suicidal depressed patients was effective in generating a rapid response and a persistent response during the infusion series. So the other question is, does ketamine cause an affective switch? And what we mean by affective switch is changing somebody from depressed to a manic phase. And in this study by Nisio in 2013, data from 3 studies, which was conducted among patients with treatment-resistant unipolar and bipolar depression, reported a transient mood elevation in 7 and 10% of subjects administered placebo and subanesthetic doses of ketamine respectively, but the mood levels returned to baseline by the next day. And so there didn't seem to be any type of effective switch. But again, there are case reports and occasional episodes where you do see a person possibly get hypomanic or manic briefly. And so there are case reports that do exist. So finally, a ketamine systematic review for ketamine therapy for bipolar depression was also performed by Zarate and his group, utilizing 6 studies with 135 participants, looking at a traditional dosing of ketamine, 0.5 milligrams per kilogram, and the number of doses between 1 and 6 doses over 2 weeks. And also through this meta-analysis, they demonstrated that the overall proportion of patients achieving a response was 61% with those receiving ketamine versus 5% of those receiving placebo. And across all the studies they looked at, it was somewhere between 52 to 80% had response. And the ketamine therapy was also very well tolerated, although there seemed to be one individual who received actually developed manic symptoms who had received ketamine, but same thing with one receiving placebo, also developed manic symptoms. So ketamine therapy is effective for treatment-resistant depression, and there's a number of different evidences that demonstrate its efficacy in bipolar depression as well. Certainly it has anti-suicidal effect, and it seems to work rapidly as well as a robust effect. But it does require maintenance therapies as well.